Are you thinking of using a back brace to help you overcome your lower back pain? Well, in this tutorial, we're going to talk about some of the benefits, some of the drawbacks, some of the ways it can help, some of the ways it can limit your progress. So we're going to talk about some hows, some whats, some whys, and as with many of my tutorials, lower back pain is specific to you. So some of the scenarios I'm going to be talking about might not be relevant, but what I'm hopefully going to convey and get across are the principles as to which is the best time to use them and when is not the best time to use them. And then you can transfer that or those principles out into your specific scenarios and case of lower back pain. The number one secret to using them is not to rely on them too much, but know when to rely on them and when not to rely on them. So that is the sort of the biggest picture, the biggest overview of everything that I'm going to be saying. And we're going to talk through, in some respects, the whole journey of overcoming lower back pain. So, for example, let's just say you've had an episode of lower back pain. So you're in pain now. But what you know is in certain scenarios, it could be lifting boxes, could be sat at your desk, could be walking around. You know that the back brace will help reduce pain so you can get on with everyday life. That is an opportunity to use it. So initially, you're going to be using it potentially a little bit more. And then as you progress through your, let's just say, rehabilitation, you're going to start weaning yourself off it as you go along that journey. And the reason we need to wean off it is because what we need to do is we need to find out what is triggering your pain. Once we can understand what is triggering your pain, it could be a movement, it could be a posture, it could be a position, it could be a load. Once we understand that, we can start putting a plan in place to be able to overcome that. But what you have as you're going through that is you need to get on with everyday life. It's not just a case of everyday life is going to stop and then you can get on with recovering and overcoming and rehabilitating your lower back pain. So we've got that balance to be working on. So if we, essentially, it's a crutch. So if we have an opportunity to use that crutch to be able to get on with everyday life, then we can use it. What we then need to do as we progress is obviously reduce that use and get back to normal use without the brace. Because essentially what the brace is doing, it's acting like a super stiffness around your torso. So it's creating the muscle tension to stabilize your core rather than your core doing it. So that's what we need to put in place to be able to wean ourselves off. So whilst we're on that journey, so we have the initial episode of lower back pain, we might use it to be able to get on with everyday life. What we then have is a plan in place. So we understand the triggers, we understand what keeps us pain-free, so we start building that in the, let's just say, rehabilitation program. As we go along that rehabilitation program, we might use it at certain times and then we'll take it off at certain times to be able to improve our the robustness and the resilience of our torso. What we then start doing is then building the core back up so it can cope with the rigors of your everyday life. What we've then got is the core doing the job of what the back brace would normally be doing. So let's take the example of someone who has a manual job and they need to be up on their feet, moving around, lifting things, carrying things, so on and so forth. So they have an episode of lower back pain whilst they are aiming to pick something up off the floor. Now, what we might encourage them to do, obviously there's going to be a period where they'll need to be possibly away from work and away from doing that, but there's going to be a point where they need to go back to it. So what would be useful, if they're doing it for 8 hours a day, is there is a good chance that they are going to need to come back when their core is still in a, let's just say, deconditioned position. So we need something that can give some condition to the core or some protection to the core until we get that condition there. That's where a back brace can be useful. Now, for example, if they went back to work and they knew they could get through 2 hours of the day without any pain, and then after 2 hours you sort of feel it come on and it would get progressively worse throughout the day. So it might be useful to to not use the back brace for an hour and a half. Then you put the back brace on. You may have it on for an hour, and then you notice, so that would then be hour and a half without it and an hour with it. So that's 2.5 hours. So normally, if you weren't wearing it, you would be in a degree of pain. It might be dull, it might be more intense. But when you wear it for an hour, you might notice that the pain either decreases or is completely eliminated. So you've done 2.5 hours without any pain. So what you could then do is take that back brace off and then go and do another hour, for example, and then wear the back brace for another hour. So we've then done 4.5 hours of, in some respects, it's a bit like doing intervals. So we wear the back brace, we don't wear the back brace. But this process of knowing when to wear it and when to take it off in this regard, or in this specific situation, needs to come with some sort of understanding of when the back pain comes on and when you think it's a good time to take it off. So there needs to be some degree of, let's just say, creative thinking, because we are just sort of, we don't know exactly when the back pain's coming on and when it's going to go off or what it's going to do with the back brace on. So that would be part of the example of rebuilding the torso, but being able to go about your everyday life whilst you've got your bad back. So that's sort of one half of the scenario, is you being able to go back to everyday life and just be able to, in some respects, survive it without being either in a great deal of pain or in any pain at all. Because again, some of the goals that we need to put in place, obviously the main goal is to be out of pain. But we need then sub-goals in between that. So if we're understanding that our pain is at 6 out of 10, 10 is excruciating pain, and 6 is 60% of that. Again, these are arbitrary numbers, but I want the principle to come across. So we might then think, okay, well initially let's just see if we can get it from a 6 to a 4 out of 10, and then a 4 out of 10 to a 2 out of 10. So initially we're just reducing the pain. So if we can do that over a period of time, then we're starting to progress. It's not just a case of I'm in pain and my goal is to be out of pain, and if I'm not out of pain, then everything is failing. What we have to do is look at the quick wins or the small wins to think, okay, I'm at a 6 out of 10, can I get it down to 4, can I get it down to 2? So those again are some extra parts to the puzzle. So we've talked about the everyday nature of it and when we would use a back brace. Now alongside that, we need to be putting in place some sort of rehabilitation program. Now what that means is not necessarily, it's a core exercise program, because some people might not need it, some people might not want it. So what we have to do is we have to think in a way, it could be exercise, it could be stretching, it could be mobilizing, it could be some sort of therapy to relax tight muscles in and around the hips and things like that. So we have to think about, again, what is that in your specific case? But let's just take it down the sort of exercise and stretch route, because that's the most sort of method that's going to be highly used. So what we need to be thinking about is rebuilding the core, so we don't need the back brace to do what the back brace is there for, which is essentially act for the muscles. We want the muscles to do that. So we need to be thinking about what movement patterns are you using? What posture and positions are you using within those movement patterns? And also, what loads is this person who's moving around and lifting all day? So we then need to think about all of that. So that needs to become a part of it. So it's just a sort of workshops or coaching programs which are built around the movement patterns, making them better and improving them with regards to joint position and the posture, making sure they're lifting correctly, making sure they are, for example, keeping the weight close to them if they're able to do that. Again, the object that they're lifting could be a part of it, because it could create a poor lifting position or posture because of the size or the weight or the nature of the object that they're lifting. So again, that needs to come into place. What we then need to think about is, how are we going to rebuild the core? So we would think about some exercises. So we know they need to brace the abdominals and hold tight. So we need to learn that skill first. We need to learn to brace the abdominals. We need to learn to hip hinge and get into that good lifting posture. We then need to sequence everything. So when we go down into the posture, we brace the core, we lock in the shoulders, and we, in a sense, bring super stiffness to the torso. Once we've done that, we can then again go about lifting the objects and going about the work and thinking about, can I use this back brace less than I'm using it? So instead of using it for an hour at a time, can I now use it for half an hour at a time? So again, we're weaning ourselves off it. What we then might do is, if we can't get into the position that we want to get into, can we improve the range of movement of certain joints? So it could be ankles, it could be hips, it could be knees. So we would look at all of that. Could be thoracic spine as well. So we would look through all of that, and we would then use our stretching to try and increase the range of movement of those joints. What we would then do is then think about the exercise, sort of in some respects, as the last part of it, to rebuild the endurance of the core so it can last longer. So what we might have done, as I've talked about, we do an hour and a half first, and then we do an hour with the back brace on. So we would think about it, okay, let's do our hour and a half. Once we get to doing the exercise part of it, we may be down to half an hour. So we then start doing the exercise. So we rebuild that endurance in some respects to the next level. So we would use planks, side planks. We would use carrying exercises as well, because that's what they're doing in the nature of their job. So we need to be thinking about not only just doing the planking and the side planking to build the endurance of the core, but also we need to be thinking about the movement pattern. So if they're carrying it across a warehouse or a whatever, wherever they may be, if they're carrying it, we need to be thinking about, okay, we go into a plank, we get up from the floor in a safe, resilient way, and then we go into some sort of lifting and carrying and then walking movement pattern. Then we could come back, again go into planks, side planks, but again we need to build that in a systematic way so the exercise doesn't aggravate the back. So again, it might just be we do a few exercises to start with, and then again, as we sort of use the feedback all the way through, is my back sort of going towards pain, or is it going towards pain free? So if you can feel it coming on, we ease back. If we don't feel it coming on, we just try and push the boundary a little bit more, but not too much, because that might initiate it. So again, it's a very fine balance that we're trying to maintain to be able to get you back to let's just say full fitness, if you will. And the back brace can be a part of that. But what we don't want to do is just wear it the whole time, because what's going to happen then is your body's not going to learn what to do, your brain's not going to learn the movement patterns, and forever and a day you're going to be relying on that back brace to keep you being able to do everyday life, whatever that may be for you, and your core is going to be an unresilient core. So at any point whilst you're doing anything, you're going to be vulnerable to another episode of lower back pain. So if you want to reduce your risk of lower back pain, you've got to rebuild those movement patterns. Well, first of all, you've got to understand your lower back pain. You've got to rebuild the movement patterns. You've got to then improve those patterns using stretching and then building that endurance with some exercises that are not only core specific exercises, but also that sort of work on the movement pattern and carrying load to challenge the torso to be able to work in that way. So although I haven't talked a lot about the back brace in and of itself, because in some respects it's quite simple, it's just there to do what your muscles aren't doing. So if you want to use one, you can, but just don't rely on it, and make sure you've got something in place to be able to rebuild that core for the future. And then as you're doing that, weaning yourself off as you get feedback from everything that you are doing. So many thanks for watching. My name is Chris. I'll speak to you in the next tutorial.